the Africa Center for Disease Control and the African Union Commission have launched. Of course, will be launching rather next week an African against COVID-19 initiative during the high-level African Union Bureau meeting of head of states and governments. The initiative is necessitated by the need to save lives, economics and livelihoods. The Africa CDC said a consortium for COVID-19 trial has been submitted to the AU for approval. Let's have more details of that in this report by Sona Tunkara.
The Consortium for COVID-19 vaccine trials, which was established to ensure Africa's leadership in the development and access of COVID-19 vaccine, has developed a vaccine strategy for the continent, which has been submitted to AU leadership for approval. During the epidemiological situation weekly press briefing on coronavirus on Thursday, Dr. John, Director of Africa CDC, says sites have been identified to enhance the process of vaccine clinical trials.
Sites have been identified and categorized into 3 tiers. The first tier being clinical trial sites that can readily start vaccine trials. The tier 2 sites are those that will require some minimum capacity building and development to get us to where it has to be. And then the third tier are those that require some substantial amount of investment. A steering committee has been put in place, and we had a meeting, a broad consultation meeting yesterday with across the continent and outside, and stakeholders from outside the continent. We are hoping that in the next coming weeks, we'll be able to develop a comprehensive guidance for countries to use to develop vaccine plans. That is, in case there's an effective vaccine today, what do we do as a country to roll out those vaccines at the country level?
With healthcare workers facing devastating attacks by the virus, 50 countries in Africa have reported 35 deaths of healthcare workers infected with COVID-19. The source of transmission among healthcare personnel and the community, according to John, is uncertain, and as a result, the Africa CDC will embark on a capacity training across its member states on infection control and prevention for healthcare workers.
Our healthcare workers have the right infection prevention and control measures. So because of that, we are cascading training across multiple countries as Africa CDC to enforce and provide the capacity for infection prevention and control, what we call IPC measures, because that is key. We are dealing with a virus that is very easy to be transmitted. It spreads very quickly, and if we do not ensure the appropriate IPC measures, infection prevention control measures, you see that a large number of our healthcare workers will be infected, and the consequences will be devastating for our healthcare system as a whole on the continent.
Dr. John, in today's briefing, emphasized on the importance of the African continent taking the lead to fight against the virus with the adoption of traditional medicine.
It would be a mistake that we do not factor in our traditional remedies into the fight against COVID and other diseases. I think we are very encouraging of those that participation. We're also saying that when we do that, let's do it in a way that is standardized. Let's do it in a manner that it shows efficiency. Let's do it in a manner that there's efficacy, which means any product that we put out there shows that it is effective and also safe for the patient. And we are very open to that. I mean, we should evolve to a manner that our traditional medicine is also recognized as what it.
The global number of COVID-19 cases is over 20 million. In Africa alone, more than 1 million cases have been confirmed, with a death toll of over 24,000. However, there has been a significant improvement in the number of recoveries, as over 769,000 people are reported to have recovered from COVID-19. For iAfrica TV, Sohna Tunkara.